Welcome to Thinking Green. Well, by a twist of fate, today is International Women's Day, and this was not planned, I swear. But my guest today is Laura Cordes, who's the Executive Director of Connecticut Alliance to End Sexual Violence, correct?
Yes.
I got it right. It's a
did.
new name. It used to be CONSACS, but I'm guessing still the same mission.
Absolutely.
And so we are going to talk about the problem of sexual violence and what's in the work to make things better. So welcome, Laura.
Rana, thank you so much for having me. It's very nice to be back on Thinking Green. It's been a number of years.
It has, and it's nice to have you visiting New London.
Yeah, nice to be back in New London.
So I guess maybe I can start out asking you about the organization,
Sure.
Connecticut Alliance to End Sexual Violence, and what the mission is, and
So
what you do.
for over 30 years, we've been the state's leading voice to end sexual violence, and I appreciate you pointing out our new name. Many folks might know us as Connecticut Sexual Assault Crisis Services, or CONSACS. We changed our name at the end of 2015. Our mission is still the same, to end sexual violence and provide high quality, comprehensive, and culturally competent sexual assault victim services. And we changed our name because we wanted to be very focused on our mission. And while Connecticut Sexual Assault Crisis Services pointed out that there were services, we not only want to support victims and survivors, but we don't believe that sexual violence is inevitable. We think it is preventable, and we think that we can end sexual violence. And that is our focus. We wanted to be very pointed about it in our new name.
Well, I must say it doesn't trip off the tongue, but it makes more sense.
Yes, and we're also trying not to go with an acronym. We'll be known shorthand as the Alliance.
Oh, okay. And I know that the URL for the website is endsexualviolence.org.
Yes, endsexualviolencect.org. So again, we want to lead with a main part of our mission, which is to end sexual violence. So as a coalition, we are a coalition of 9 community-based sexual assault crisis service programs. The program that serves southeastern Connecticut actually has an office in New London and an office in Willimantic, and serves from top to bottom, north to south, that part of the state. And they're called the Sexual Assault Crisis Center of Eastern Connecticut. And I know at some point we'll actually have, there we go.
Yeah.
There we go. There are hotlines. So we are one of 2 states that have not only statewide hotline in English, but in Spanish as well. We have a large Latino, Spanish-speaking, and bilingual population in Connecticut. And nearly 20 years ago, we made the decision to make sure that not only would we have a statewide hotline in Spanish, but that we would ensure bilingual, bicultural, Spanish-speaking advocates at our programs.
And we do have a map if people want to see the
service areas?
Yeah, the
Sure.
service areas.
So maybe while we're pulling that up, I'll talk a little bit
Sure.
about our services. So folks might think of rape crisis centers, and I'm so glad you mentioned International Women's Day, but sexual violence is certainly known as a women's issue, but it's also a child issue, and it's also a issue for men and boys.
It is.
It's really, I think, you can't turn on the news or go online without seeing, tragically, a story about sexual violence in our country, whether it's in the workplace, in our schools. And I would like to suggest to folks that it's not necessarily an increase, but the work that advocates have been doing and survivors themselves, demanding justice, demanding better services, that has changed our culture to create safer spaces for people to come forward. So we're really seeing a shift in the way that people are talking and addressing sexual violence. But for our service area map, thanks so much for pulling that up. We provide services statewide. So that's in every corner of the state. You can pick up one of our toll-free confidential hotlines, 24/7 access to a certified sexual assault crisis counselor. It's not just for someone who's survived sexual assault, whether it was hours ago or 20 years ago, we're there for you. We're also there for family members and supporters of survivors who are really trying to help someone navigate really complicated feelings and issues as they work on their healing and rebuilding a lot of trust that they've been robbed of. Each of our programs not only has advocates to serve them, but we also provide support groups, individual counseling, and we're really unique in that not only do we just focus on sexual assault, but that means we focus on the systems that victims and survivors have to navigate through. So we'll provide advocacy and support at a hospital following a sexual assault when a victim or survivor may be deciding whether or not to undergo an exam and evidence collection. At a police station when someone is making a report to the police, and certainly if a case goes forward through the criminal justice process, which I can imagine most everyone knows is not like Law and Order, does not get resolved. Many cases actually don't move forward after a report.
Certainly not after an hour.
Not after an hour, but it can be arduous
years.
and take years, absolutely. So we're really there for victims. Our model of counseling and advocacy is driven by victims and survivors themselves. And then our rape crisis centers, that's a little bit about what they do, the immediate work to talking to someone years later. But we also have 12 specialized post-conviction victim advocates that work throughout our state's sex offender supervision and sex offender management unit. So when an offender is released onto probation or parole in the state of Connecticut, and this is very unique, there's a collaboration among probation and parole officers, specialized victim advocates, as well as treatment providers who set conditions around the release and the monitoring of offenders in the community. So our victim advocates are there not only right after an assault, but after a conviction when offenders in the community, because it could be 6 months, it could be 6 years later, and victims deserve the right to know about what's happening with the offender and deserve to have their interests met when we're thinking about how this offender is re-entering the community.
Now, would you say we've made progress? You were last on the show about 8 years ago, we figured out. So what kind of progress has been made?
I'll try not to be listy, but I think we noted that perhaps one of the last times we talked was about ensuring that all victims had emergency contraception in the hospital following a sexual assault. So for victims who were concerned about the possibility of becoming pregnant as a result of the rape, we believe they deserve to have the timely medication. Not an abortifacient, but a medication that could prevent a woman from becoming pregnant. And that wasn't happening. It wasn't just a Catholic hospital problem, but at a number of hospitals, they were giving a victim a prescription. So we passed that. So now victims under Connecticut law have access to emergency contraception. They also now, thanks to the work of our organization and advocates and allies across the state, we've actually created the state's first, what's called the Sexual Assault Forensic Examiner Program, a SAFE, or some people might know them as SANES. So when we imagine a victim coming forward to the hospital and collecting specialized evidence, it really takes someone with an understanding of sexual assault victim dynamics, and certainly who's trained in the collection of evidence following a crime, because it's a unique crime because so much of the evidence is on the person. So we had done all this work to make sure that hospitals, that there were guidelines, that there was something people might know as a rape kit. We call it a sexual assault evidence collection kit in our state, that we had advocates responding at the hospitals, that the hospitals even had some level of compensation to perform an exam. But the last thing we were missing was the actual practitioner who was specialized in collecting this evidence. We now have the SAFE program responding to 12 of Connecticut's hospitals, and I believe next year we'll be asking the state for additional funding, which seems like a long shot, but that's what we need if we're going to be serious about collecting evidence that can be used to provide victims justice and be able to identify and arrest offenders.
Now, are those 12 hospitals found throughout the state? How's the logistics of that if I'm in New London and the collection experts are in Middletown?
Well, currently, at any hospital, you can have an exam and evidence collection done. So a victim can be treated, and the state, and this is something important for the audience to know, is that victims first it was under state law, and now federal law, cannot be billed for the exam and evidence collection. So if I happen to break my arm in the course of the assault, I may be billed for that. But an initial exam, prophylactic treatment for STDs, pregnancy, as we talked about, if I'd like that, HIV, I will not be charged for that, as well as I will not be charged for the actual collection of the evidence. Now, who performs that? There are some nurses or physicians who may have been doing exams maybe in another state or worked, let's say, a third shift and become very proficient. But there are many who are not. So the hospitals, it started off in Wyndham, Hartford Hospital, Manchester Hospital, it's Middlesex Hospital. We now have safes at Connecticut Children's Hospital, and soon we'll have it at Yale, Bridgeport. So we're moving down into Fairfield County. And last year there was a bill that would provide, and the program started at the UConn Health Center at Storrs, so specifically for UConn students. So victims can go to any hospital and expect to have care and treatment following a sexual assault. Also important to know is that you can have evidence collected up to 5 days following an exam and not be billed. So we're able to find evidence in many cases up to 5 days following an assault.
Oh, I'm surprised to hear that.
Yeah.
So you gave a good explanation of the process that a person would go through, but I guess maybe we can talk about what still needs to be done in Connecticut.
There's so much, and I know we started with the
and we'll go back to the
but
victims again, but I'm curious about
especially
what
if we looked on
to do.
So much. If you think about sexual assault and how, and I'm generalizing here, if you grew up, generally speaking, in this country as a woman, you get messages about sexual assault being your fault. If it happens to you, it must have been something that you didn't do right. You didn't follow the rule of covering your drink or doing. So how it is that we respond to victims, it's a very brave thing to disclose, because there's so many myths about sexual assault, who commits those acts. The responsibility should not be on the victim but the offender themselves. But when we hear about sexual assault, so many times the response is, well, what were you doing? So somehow victims find themselves blaming themselves. They also may have had threats by the offenders or the offender family.
Internalized and externalized.
Absolutely. So the fear is really certainly real. And when victims come forward, not only do they have to survive the assault, but they have to survive the response from people that they know and love, who are questioning or somehow minimizing what happened to them. So to actually report, not just disclose, but to report and go forward for an exam and evidence collection is a very brave thing for survivors to do. And to your question of what needs to be done, we've spent a lot of time making sure that when somebody discloses, that they're met with a compassionate and non-judgmental response, because certainly that's what they deserve. But if they are not, and we work with so many victims who aren't, they are not likely to ever bring it up again, not likely to reach out for services and support, and certainly not thinking about reporting to the police. So a lot of what we've done is make sure that there are family members, professionals that might be the first responders in school, know how to receive a disclosure and support the survivor and help them get a referral to one of our programs. But when we're talking about the kids and what needs to be done, last summer we released a report called Untested. And what that was about is, and if folks have followed some of the news in our country over the last year, there have been reports of rape kit backlogs in Detroit and Houston and LA and cities around the country. And we started to look a little over a year ago through a group that I sit on called the Commission on the Standardization of the Collection of Evidence in Sexual Assault Investigations. We call it the Evidence Commission.
I'm very impressed that you remembered
Thanks.
all of those words.
But the, you know, and this is where I say the states actually spent a lot of time. We were one of the first states to standardize the evidence collection kit, to think about these protocols, and then finally to start getting a SAFE program. But we took a step back and we said, we're doing all this work, we're putting millions of dollars into these programs, and then what is actually happening with the kits? We know our lab was doing a good job in turning around, in the state of Connecticut, we have one crime lab. So all the judicial districts, all the PDs feed into that one crime lab.
Now, is that adequate at this time?
You know, you'd need to talk to the lab, but where we are with sexual assault evidence collection kits, I'll tell you, it has been. There will be, there's a backlog coming to our crime lab, because what we found, Rana, in our report is that we did a survey of all the PDs, all the police departments, all the towns in Connecticut, and thankfully all the police departments, except for one, and we eventually got their numbers as well, but they all voluntarily participated. The questions we asked: how many kits go into your evidence room? How many sexual assault evidence collection kits have not been sent to the state crime lab for testing? How many within the last year? How many over 5 years? And then we also asked, because in the state of Connecticut, victims have, when they go to the hospital, they could choose to have their kit be anonymous. So the state has an interest in gathering that evidence. The victims certainly, if they're thinking about going forward, but they've just survived a trauma. They may not know what they want to do, but the state will gather that evidence to have it. And we thought, well, how many of them are anonymous kits? So maybe the victim was undecided about reporting. Let's find those numbers. Our total numbers, what we found is a backlog of kits at Connecticut's police departments, totaling 879 kits that needed to be tested. Nearly 40% of those kits were over 5 years old. So there's
Can you still get evidence after 5 years?
Yes, what we're finding, I mean, there's been, the good news is that Connecticut is moving quickly to address the problem. So as advocates, I'm really proud of the work that we did to highlight this problem with the Evidence Commission. We took that data and we did our own report with recommendations about what steps the state should be doing. And many of those steps, just even in the last year, we've moved forward on. Specifically, we became one of the first states to set clear guidelines and a time frame for the transfer of those kits to the crime lab, which is 10 days. So when the police pick them up from the hospital, they now have to be delivered to the crime lab within 10 days. We are now a state that's going to test all kits. When a victim wants their kit tested, which is the majority of victims that come forward, right, the lab is going to test those kits, and the new law says the lab will test them within 60 days. So moving forward, as of October 1st, that's the new guideline, and the state is moving forward in the right direction. The state has secured funding through, became one of a handful of states to get funding through the Department of Justice, called the Sexual Assault Kit Initiative, to pay for the testing of these backlog kits.
How costly is it?
It's about $1,000 to $1,200 per kit. So in other states, they actually just don't have the money, or other cities that are looking at this. I mentioned Detroit. I think they had over 10,000 kits.
It's sort of a disincentive to put yourself through it if you don't know what's going to happen.
And that's exactly it. Each
to the
879 kits mean 879 victims that are waiting for justice and who went through, and I don't need to describe it, you can only imagine how invasive this exam is. Hair pulling, fingernail scraping, taking your clothes, and this all after you've been sexually assaulted. The last thing you want to do is be touched and by a stranger, and in a very invasive ways. For these exams take hours to do. So after undergoing the exam, victims deserve to have their evidence screened and tested. And what we're finding from other cities that have started in on this process is that, DNA, now we know there's a CODIS system, we can find serial offenders, we can even exonerate individuals, but we can move forward. Everyone is concerned about sex offenders, but here we have this tool, and here we've set up this system, and on the one hand we say, victims, we actually leave it up to the victim on whether or not they want to report to the police. But you have a whole society saying, oh, you should report to the police. Well, if I come forward and report to the police and then I find that no one's taking my case seriously and or they were unsure about the protocol and didn't move this valuable evidence forward, that's an injustice. And it's a community safety issue as well.
It is, and I think people worry a lot about the offenders who are getting off, but also, if you think that some people can be exonerated, there could be someone sitting in jail and it's the wrong person.
So we've moved forward in making sure that the police departments and judicial districts, everybody knows now the protocol for what to do with an exam and evidence collection and the kits. And we've secured some funding. We also this summer, the governor came to sign that bill and also said that he would create a working group specifically around sexual assault evidence collection kits. And we're hoping that that working group will be announced very soon so we can get to work on examining those 879 cases, because we have a lot to learn about why it is that those cases and those kits particularly didn't move forward. And then out of that 879, we can actually learn and as a multidisciplinary group make recommendations to the state about what we should do for the best practice on investigation and prosecution of these cases.
Now, how are the police departments responding to this?
Many of the police departments moved very quickly. The last I checked with the lab, over half of those kits had been moved to the lab. Now, that's where we start to say, your question earlier about, so is the lab big enough? Can they do it? Dr. Guy Villaro is the Director of Forensic Science Services for the state of Connecticut, and it's been fantastic and really worked to prioritize these cases. One of our concerns was for kits that were coming up against a 5-year statute of limitation, a criminal 5-year case, so or a limit. And so you're really racing against the clock. Now we do have a law that's a DNA exception. So if you find DNA after 5 years, you could potentially go back and charge an individual. But we don't even want to chance that. So the lab's been terrific in the cases that it's getting to make sure that they're looking at the date that was collected and reported and prioritizing those kits first. But we still have a ways to go. So they, as part of their project with the federal government in getting those funds, they've hired a project coordinator, and we're working with them to not only think about a system, and many people are involved in this project, about triaging and moving these kits in a coordinated way forward, and then tracking what's happened with them. But one of the things that we'll be doing through the Connecticut Alliance to End Sexual Violence is working with our member programs and police and prosecutors about a victim notification protocol. So
I was wondering what happens if someone has moved on with her life and it's 4.5 years later and suddenly the evidence has been tested.
Yeah.
So what happens?
Exactly. So we would want to look at individual cases and think about, and I think part of that protocol is to not just send someone in a police cruiser to the home and knock on the door. Who knows what's happening in that? Or a form letter, exactly. So, and I know we can chuckle about that because we've all been in those instances where the response was maybe well-intentioned and information, but for someone who has taken steps to move on, we need to respect the victim's wishes, and we need to be as thoughtful as possible about the notification. So we're engaging in that work as we speak now, because it is, and we're learning from our colleagues around the country, and there's no, every victim and survivor is different. And some survivors, from what we've learned with colleagues around the country, have said, yeah, I had given up hope, or I want nothing to do with this, or I want you to fully move forward with this case. Because generally, if you're notifying someone, it's because you found a hit or you found information and there's a reason to open up a case.
Now, if the evidence is a hit and points to a possible serial offender. Does it matter in terms of prosecution if the victim doesn't want anything to do with it?
It all depends on the case.
Okay.
It really does. I mean, I think most prosecutors are sensitive to victims and survivors and what they'd like to see happen, but we always have to remember that this is a crime against the state, and there have been few times that I've known a prosecutor has forced a victim to move forward or can win a case without a victim. But in a serial offender case, if they have more than one case, they potentially can.
Oh, interesting. It sounds as though Connecticut practices are pretty good nationwide. Are there any places that are really, trailblazing in terms of best practices?
It depends on the issue, because when we look at sexual assault, it's sexual assault in the workplace, in the military, on college campuses.
Hey,
We're
the
looking
movie
at
Spotlight just came out.
I know.
In the church. It's huge.
Yes, it's amazing to think at all the progress that has been made. But when when we were talking about what survivors have to go through, so much of the damage, that's a really good example when you have an institution that's set up of caring individuals. Many people refer to it as an institutional betrayal. On top of being assaulted, and because there were people, Jerry Sandusky, you had a whole university, you had people who look out for, in that case, kids who turn the other way. Sexual assault is definitely in the news. It's definitely in pop culture. There's, I don't know how many listeners know Keisha, who's trying to get out of her contract because the producer sexually assaulted her time and time again, Lady Gaga, who did a song with a well-known pop songwriter. I believe her name is Diane Warren. That song, If It Happens to You, was used as the theme song in a documentary called The Hunting Ground, which was about campus sexual assault. 2 years ago, Kirby Dick, the producer of The Hunting Ground, had also done something called The Invisible War, which was a documentary about military sexual assault that literally changed the way that the military responds to sexual assault based on that documentary. So it's very powerful, the voices and the people that are coming forward to reshape our response and hold up the voices of victims and survivors around this issue.
And that's, slow progress, because in the case of Keisha, people aren't necessarily all banding in support of her.
No, and there's certainly backlash. We're seeing some backlash on college campuses to victims coming forward, but no, not everyone. And I think I think there's room for folks to. It's very hard to hear people not believe victims, but I would also say we have to leave some room for people to work through why it is that we don't believe victims, because it is so very hard for us to imagine that, if you think about 20% of our population has been sexually assaulted. 20%. So that doesn't necessarily mean that 20% of the population have offended, but I would say there's a large percent of that 20%, because most offenders will offend again until they get caught or there's some type of intervention. So it's hard to imagine that my brother, my neighbor, my priest, my teacher, nice guys, people I know and trust could offend. And it makes us feel a lot safer if we can imagine that the offender is a stranger.
Right.
And it's easier to move through the world that way, because some days it can be scary, so we all have our sense of safety. And when we hear that it's not just that our friend was sexually assaulted, but when that friend is saying it's somebody that we know and trust, it's so much. It really shakes to our core what our sense of safety was. So that's one of the reasons why people don't believe victims. And I think we have to start allowing people to have those conversations, because we need to change that way of thinking. And while it may be unacceptable to blame, certainly to blame the victim, we have to create other spaces to tease out why it is that we still think that somehow the offender didn't do that. And we've done a lot in our society to talk about victim and survivor dynamics. We don't talk a lot about who offenders are. We even say terms like, 20% of the population experienced sexual violence. How did they experience? Someone did it to them. Or sometimes we don't even say men's violence against women. So certainly, I think if you read the news, there are certainly women that perpetrate, and we certainly know not all men perpetrate.
Right.
It's just a very, very small percent of men. But it's not just a women's issue, it's a men's issue. And we have to start looking at, we have lots of incidence and prevalence studies about victimization. The CDC, Centers for Disease Control, who looks at this as injury prevention, has never done a study surveying the population about their incidence and prevalence of perpetration. So all we know is from a victim and survivor perspective, which has told us a lot. But if we're really going upstream to think about raising a generation of people who choose not to offend or who do not support people offending or looking the other way or making sexist jokes or all those things on the continuum, that we think, if we had a different level of, if we were getting after sexism and homophobia and racism and all the oppressions, we would not have people that choose to devalue people in this way. And when we look at ending sexual violence, so much of what we need to do is start a lot sooner. And when we work on campus sexual violence issues, that's what I hear a lot. People saying, you know what, why aren't we starting earlier? So to go back to where you said, what's good news, what's happened? We actually, this spring, Sexual Assault Awareness Month is in April, and the State Department of Education will be releasing, we hope it's in April, a framework of sexual assault and abuse prevention education for Connecticut schools K through 12. Connecticut, when you were saying, Connecticut seems, pretty ahead on this, we became one of a handful of states 2 years ago to say, we have to start earlier. So we know we have 169 towns, we know, and I know from your experience, school boards, you can't hand you a curriculum and say, do this, but the state can say, you must come up with a plan to teach around K through 12, and it's age appropriate, of course, but we're talking about understanding that your body is yours and asking permission and respect, but that's great news for the state of Connecticut. So our organization, DCF, and the Department of Education, and a lot of great advocates work together on this framework. And as of October 1st, all school districts in Connecticut will need to adopt and start teaching this in the schools.
That's this really brings me back in a way, because in the mid-'80s, I was a preschool teacher, and we had a really good curriculum that we used that was later supplanted by a more stranger danger kind of thing, which usually isn't a stranger.
No.
But it was based on a few principles, teaching kids, 3-year-olds, what the real names of their body parts were, trusting their senses, whether things felt comfortable for them or not comfortable for them, and assertiveness training. And it was very age appropriate. And then into the 90s, it kind of disappeared. So it sounds like that age appropriate curriculum that isn't just about mistrusting people who aren't familiar to you is coming back, which is really good news.
Yes. As well as, so we talked about our organization doing victim services, a lot of what we do, public policy, maybe we'll talk a little bit about that tonight as well, but we, over the course of a year, we train thousands of professional and community members in prevention education and training programs. So everything about the response to actual bystander intervention. So how not to look the other way, because a lot of folks see behavior that they don't like, especially men, see other
Yeah.
men say sexist, inappropriate things, and or manipulate and coerce women with alcohol, or dangerous situations where you think, if I say something, what's going to happen? But if I know my friend here feels the same way, then the two of us could intervene. And so, and or challenge the sexist joke, right? So the bystander intervention is something I think is a term people hear a lot about, but we're doing a lot of training. We have the first sexual violence prevention campaign in Connecticut. It's statewide. It's called Where Do You Stand? And it's focused on men as active bystanders. And we have over 500 men who've taken the pledge, several thousand men who've gone through this training, so they can have those conversations that we weren't having a decade ago. It's making a difference.
Well, so in Connecticut, I know this is a short legislative session, but what's happening in terms of possible legislation to make things better?
Well, can I talk about a thing that's not so good?
Sure.
Okay. So when I look at this legislative session, I think everybody knows the state has a deficit.
Yeah.
Right? And there are many programs that we all care about. Lawmakers for well over 20 years have prioritized rape crisis services by having that in the budget. So we are a state that has made a commitment to making sure that there's funding, that we have 24/7 hotlines, that anyone, child, adolescent, or adult, could get the help that they need. This year, the governor has zero funded all the line items in the budget and put them in proposed putting them in a block grant to the agencies. So we wouldn't really know if we could have funding or not, and what that would look like from year to year. So for folks who are inclined to talk to their lawmakers about the state budget, I would make a plea to ask them to keep the rape crisis service line item in the budget. We understand that there may be a cut, but we certainly don't want to undermine the commitment that we've made to Connecticut citizens for so many years. So had to say that. Put that right out there, because funding is critical. Our frontline advocates, we're nonprofit providers, so folks, we don't have waiting lists. These are free services, but if we get serious cuts, there are layoffs for services that victims and their families have depended on. The exciting pieces of legislation that are coming up, just a few, and it's a short session, so our session started in February, will end in May, and certainly the budget is taking a priority over so many issues. But one thing that I'll let folks know about is it's an issue that I don't think many people would think about, but one that is so important for a number of sexual assault victims who become pregnant as a result of the rape, and who choose to have that pregnancy come to term and choose to have that child. And this has to do with the ability to terminate any parental rights of the rapist. So I can't imagine that people are thinking about that day to day, but for the victims and survivors and a handful of folks that we might serve every year, and certainly around the country, we want to make sure that victims have the easiest access to probate courts to be able to make their case to terminate the parental rights of a rapist. No child as a product of rape should have to be raised by a mother who's in constant, being triggered by someone trying to have access to their child, or forced to raise that child together. It's just unimaginable. But what we're doing in Connecticut, and there's not a bill number, but we expect to see language in the next couple days, and we may even have a hearing next Monday. And this would be looking at the rape child custody protection. And right now, in order to terminate the parental rights of an individual, you would make a petition to the probate court. And our current statute, you only need clear and convincing evidence. to be able to terminate. The judge will look
Right.
and may choose to terminate the parental rights based on the evidence you present. Clear and convincing is the standard for every case except for sexual assault. You would need a conviction, a sexual assault conviction, in order for the probate judge to entertain whether or not to terminate the parental rights of the rapist. We think that's unfair if you think about it. We already talked about it takes a lot for a case to go
Right.
forward. So I could have even gone to the police. I could have had a kit collected. The case could have gone forward. And we live in a society and certainly in a state that pleads. So it could have been a burglary and a rape. And they pled to the burglary and not the sexual assault charge. So there could be a lot of reasons there wasn't a conviction. But you need a conviction in the state of Connecticut. In fact, you need a conviction in many states, which is why the federal government this summer passed a bipartisan bill that set aside federal dollars to incentivize states to change their law. So it's called the Rape
Wow.
Child Custody Protection Act federally, and there are 10 states now. And at the end of, in the last budget, they put a few $1 million in, and Connecticut is considering, we're advocating that we change that law because we believe that victims should not have to parent while thinking about the rapist. And there's a case right now where there's an offender who was convicted, but just to give you, a sense of what some victims go through, the offender's in jail, in prison, and is trying to contact the victim, and who has the child from the rape, and is saying, "Oh, when I get out, I want to be in this child's life." The victim wants nothing to do with it. They weren't in a relationship, and they're desperately trying to figure out how to go through probate. And they have a conviction, but it's very traumatic for her right now.
So what's the prognosis? It seems
Well, we're hopeful.
logical that
We have a bipartisan support. The new senator in southeastern Connecticut,
Paul Formica.
Paul Formica, this summer, and I think even last session he was hearing about this nationally happening and reached out. So he's been very interested in seeing the bill move forward. I know the administration is as well. I think everybody's waiting for the language in the bill to come out, but I'm hopeful that we'll see reform on this front this session.
Yeah, considering the precedent for everything else is, just clear evidence, it seems
Yes.
It seems odd that the current language ever really was put into law.
Yes, it does.
So what else is happening with this legislative session?
Well, we also today was paid family leave. You may know that I don't think is there a state in this country that has paid family leave?
I don't think so.
I don't think so. It would be nice for Connecticut to be the first. And of course, we care about it because sexual assault is not only a criminal justice issue, but it's a health issue. And so being able to take care of a family member or yourself, if needed, after a sexual assault is important. And having paid family leave, I'm sure would help many survivors cope and heal and take the time that they need after an assault. And we also testified last week on an act concerning affirmative consent. And this is, I think folks may know, campus sexual assault is it's a huge issue in our country. And in Connecticut, we have been working with campuses for nearly 2 decades to look at best practices in response to and prevention of sexual violence through something called the Connecticut College Consortium to End Sexual Violence. And 2 years ago, lawmakers started to look at a very comprehensive response, and our organization was involved in pulling folks together to think about what response should look like in Connecticut. So we have a very strong bill that already says each campus needs to have a sexual assault policy. They need to have an MOU with rape crisis centers in their community. They need to provide victims. Certainly it's now under federal law, but at that time Connecticut was doing something a little ahead of the federal government. But really, both the victim services component, mandatory police training for mandatory police training for police,
Yes.
and mandatory prevention, education, and training programs for all students, all staff, and all of the administration that would be working on any cases that could come forward. Because sexual assault on a college campus is not only a crime that somebody could report to the police, but it's also a violation of each and every campus's student misconduct code. So many students choose to go forward on campus because the standard of proof is certainly very different. Right. You know, they just want the situation to be addressed. They want it to be addressed quickly because they're in school a short time. They need to get to class. They have dorms that they live in. They don't want to see the offender every day. So it's a very different dynamic than going through the criminal justice process. What the Act Concerning Affirmative Consent addresses is this idea that, again, many of us grew up with. Yes means yes, no means no, but the absence of no does not mean consent. And we've kind of had this green light policy, you know, certainly not stated, but that someone who might want to engage in sexual activity, they just do it until somebody says no. And I think people in healthy relationships, you know, understand that there's an act of, you know, you want some verbal consent, you want it to be active and ongoing and clear, and that healthy relationships and sex is, sex by definition is consensual, right? And so we're looking to foster that not only as healthy relationships on college campus, but if there is an accusation of sexual assault, that the investigation is not just about, did I say no? Because if I'm traumatized, if I'm worried that if I make a noise or say no, that I could be injured. There may be many reasons why I can't say no, incapacitated.
On college campuses,
on
I'm
a college
thinking
campus, sure, that can sometimes be a factor. But what we want is, if that's the case, we want everybody to know that you need to, in order to engage in sexual activity, you want a yes. And so if there is a case of sexual assault that's brought before a campus hearing, that the investigation would include talking to the respondent and saying, so at what point did you have consent? What did that consent look like? And not just talking to the victim about how it is that you said no, or why didn't you say no? You should have said no. Or so that's what we're trying to uplift, a definition of consent that's affirmative, active, voluntary, clear, and not just the what I think people have believed as just a no means no. No means no still stands, but yes, and affirmative and clear and ongoing is what we're trying to achieve. So that bill would, the nice news is, since we've been doing all this work on college campuses, the state did a research report. It's called an OLR, Office of Legislative Research, came out with a report in January and found the overwhelming majority of campuses, UConn, Yale, Wesleyan, so public, private, the CSU system, have affirmative consent policies already. So this would be asking for a consistent policy throughout all of Connecticut schools. So it's good policy, it's really clear for students, and it would certainly continue the education that you're getting now from K through 12. So it doesn't undermine anything that we're putting in place for our youngest students going forward.
Well, we're down to our last 2 minutes.
Oh my goodness.
So maybe just tell people where they can get more information and find out how to support the effort.
Thank you. Sexual Assault Awareness Month is in April. So to find out what's going on in the community nearest you, you can go onto our website, End Sexual Violence CT. .org and find local programs, information on our policies, and as we get closer to April, activities not only at the Capitol but also in your community that you can engage in. I'll also say sexual assault crisis service programs need volunteers. You can become a certified sexual assault crisis counselor and advocate, volunteer on our hotlines, donate sweats for victims who might need them at the hospital. There's lots you can do. I encourage you to pick up the phone and call the program closest to you.
That sounds
Thank
great.
you.
Thank you so much for coming down to New London. Again, lots of information. Next week, we're going to shift to a very local focus, and Tim Hanser will be on the show and walk us through the New London budget process. So
I should
that's
come
next
back.
week. And thanks again, Laura.
Thank you for having me.
Nice to have you here, and we'll see you next week.
My baby told me that he was gonna have to let me go. He said you gotta leave and try on the open road. So I said, baby, come on, can't we just go on home? He smoked his cigarette and he just said no. So I will be alone. Well, I had no shoes.